everyone. So, Assalamu alaikum, everyone, and welcome to our webinar today on advocating as legislators and physicians. This is the fourth webinar in a series of webinars that the APPNA Advocacy Committee will be conducting throughout the year. We continue to promote APPNA's mission of promoting healthcare-related advocacy issues. My name is Dr. Sabina Qureshi, and I chair the Advocacy Committee. Today, I'm very pleased to be joined by our APPNA Activism Lead and BOD member, Dr. Arman Raza. He will be moderating the session. As well, we are also very, very honored to have some very distinguished physicians who also serve as legislators. Now, just to give a brief overview of the format of this webinar, Dr. Arman and I will be interacting with you, with the guests here, with a series of questions. And then towards the end of the webinar, we will allow our audience to submit in the chat their specific questions that we'll share with our legislator panel. So let's get started. Dr. Arman, over to you.
Thank you, and welcome everyone, and thank you, Dr. Qureshi, for a kind introduction, and thank you, Dr. Babar Rao and the BOD for allowing us to do this. We have three esteemed guests here. It's my honor and privilege to introduce them. We have Representative Dr. Suleiman Lalani, who is serving his second term representing the House District 76, which includes Sugar Land, Stafford, Richmond, and Meadows Place area of Texas. He was elected in 2022, and he is the first South Asian and first Muslim member of the Texas Legislature and a founding member and co-chair of the RP caucus. He's a physician in the Sugar Land and Greater Houston area for nearly 30 years. Dr. Lalani came to U.S. in the early 90s and is focused on closing gaps in healthcare access through policy, clinical practice, and charitable work. He is currently the only general practitioner in the Texas Legislature. In the 89th session, he authored over 270 bills, 83 of which became law with no vetoes. His work includes protections against online impersonation and deepfake images, expanded career and technical education for justice-involved youth, record public education investments, campus fentanyl education, creation of statewide dementia institute, and stronger food, nutrition labeling, and public school physical activity standards. Dr. Lalani also serves as Vice Chair of House Committee on Land and Resource Management and on Higher Education Committee. He's board certified in internal medicine, geriatric medicine, and hospice and palliative medicine. He's a certified medical director and has held leadership roles in multiple health and community organizations such as Alzheimer's Association, Aga Khan Foundation USA, and Multiple Sclerosis Society, as well as Fort Bend Rainbow Room and the Exchange Club of Fort Bend. He lives in Sugar Land with his wife and 3 children. Thank you, Dr. Lalani, for coming. Next, we have Dr. Saud Anwar, who has a long record of serving our community and delivering results for Connecticut families. He's a physician specializing in lung diseases and critical care medicine, and he served for 20 years as chair of the Department of Internal Medicine of Manchester Memorial and Rockville General Hospitals. In the Connecticut State Senate, Senator Anwar has been a leader on early childhood care, pandemic recovery, and making Connecticut safer and more affordable. Senator Anwar and his wife, Dr. Yusra Anis Anwar, who maintains a private practice in internal medicine, they live in South Windsor area with their sons. Thank you, Dr. Anwar, for being here. Our third panelist is Dr. Zafar Iqbal. He's an internist by profession, but passionate about organizing the South Asian and Muslim community. He was formerly Bernie Sanders' co-chair for Nevada in the 2020 presidential election. He is also a former second vice chair of Nevada State Democratic Party and then a member of DNC. Thank you, Dr. Zafar Iqbal, for being here.
Thank you.
Okay, so how we're going to do is we'll start off with a few questions for the panelists, and we'll go over it one by one. Thank you all for joining once again. The first question would be to all the panelists. Since you're both practicing physicians and public servants, what was the moment or the issue that made you decide that serving in elected office was the most powerful way to fulfill your duties as a physician. We can go one by one. Dr.
I'll
Lalani?
yield to Dr. Lalani first, perhaps.
Sure.
I was thinking of giving you the honor. Well, thank you. Assalamu alaikum. Good day, and may the peace be upon you all who are all your viewers and listeners. And thank you for APPNA and the leadership for doing this. And given, one fine day I was in my clinic and I happened to see Ms. Jones. And after the pleasantries, we did the examination and history and all that, and I saw something. So I said, you know what, Ms. Jones, I think you're not taking your medications. And she very politely puts her arm on my shoulder and says, oh, no, doctor, you are too kind. I was at my daughter's house. I missed my 2 days of medicine. I'm fine. We are okay. I see her in the next few weeks, and same story repeats. And then, this time I was a little strict, and I said, I know for a fact you're not taking your medicine. And she tells me that, yes, doctor, I'm not taking because it's not covered by my insurance. So I did what any other doctor would do, try to give some samples, make some phone calls to the friends or whatnot. And I said, you know what, have you heard about that $4 that you can go to your grocery stores at Walmart and places where you can find medicine? So she said, yes. So I reviewed her medications. We made some changes. And I said, okay, these are not covered, but you can get it for $4 now. So we should be good. And she said, yes, happy visit. And then I see her in a few weeks again. And the same issue. So I was now very upset, and I kind of, talked to her in a strong voice that, Ms. Jones, what is your problem now? And she looked at me with a tear in her eye drop. And, she said, Dr. Lalani, I'm on 8 medicines and John is on another 8. 16 times 4 is a number I can't afford. And we all have Ms. Jones in our lives, right? I see the head nodding. So we see this in our clinics. We see this in our masjid. We see this people in our community. We see those grandpas, grandmas who's rationing their medications. We see people doing 2 jobs yet having difficulty. So at that moment, I realized that we cannot cure everything from our prescription pad. Some of the diseases needs policy change, and that was my pivot. And then that's what I've been doing, and I'm very proud to say I'm a physician first and legislator second.
Thank you. So, Dr. Saud, how would you like
Yes.
to address that?
Thank you so much, Dr. Qureshi and Dr. Raza, for the groundwork that you've done. And Sabina, you've been amazing. You've been in communication. You're very gracious. Thank you for giving me this opportunity. So, we go into public service as physicians to try and do the best to help people's lives. And to the point that Dr. Lalani was making, it's very difficult to be able to make a difference when you know what needs to be done, and then how can you make that happen. In the same way, in my career as a physician, I would not consider myself a physician till I felt that I was able to take care of public health. So I actually went through training to did a master's in public health and training in pulmonary and critical care medicine. And as I was going through this, I felt that it was important not only to take care of a patient, but take care of a society. And in order to take care of a society, you have various roles. So I felt it was important to give back to the community. I became quite active in various roles. I became active within the community that I'm a part of, within the Pakistani-American community, became part of APPNA's active community as well. And as we moved in that direction, you started to look at that, okay, you're very much focused of the people who are of your similar heritage, which is good, and it's the first reaction. But you also recognize that you are living with everybody else around in the community, and you have a responsibility to take care of their issues. And that's when I actually started to change and shifted towards being less into the community efforts, not emotionally or otherwise, but actually I still care about all the people who are of my background or Pakistani American community. But I felt in my neighborhood and the people that who are my neighbors, I'm responsible for taking care of them. That pathway led me to become part of the Democratic Party. They were very gracious. There was an opening. I became a town council member, and I served in the town council just for 1 year before there was an opportunity for the election again, and the people were very gracious. They voted me to become the mayor of the town. I became the first mayor in New England of Pakistani heritage, or a Muslim mayor, and even in the larger region. And then I was fortunate enough to get re-elected and continue to serve. I felt it was a blessing. We were able to make very important policies. Connecticut's town, where I have served as a mayor, is the fastest growing town, one of the most sought after town. The property values have gone up, the people are happier, the education system is improved. And while this was all going on, there was an opening in the Senate. People were very gracious of 4 different towns with some over 100,000 people who were going to elect an individual. They were gracious to give me this opportunity. Now the natural transition was as a physician. I'm currently serving for the past many years. This is my 4th term, and then inshallah this November I'm going to be running for my 5th term. And I'm the Senate chair of the Public Health Committee, and I'm able to use my medical background and work on this. But I continue to see patients even right now to make sure that I'm connected with my first love to care for patients, and then put that experience into the reality of policy that impacts individuals in our community, and then know that every single day the things are getting more difficult in the medical field to make a difference. So the journey continues on, the fight continues on, and all the physicians who are fighting every single day, I want to take it to the next level for policies to help our patients collectively. So thank you for your question.
Thank you. And Dr. Zafar, I think you've had an opportunity to even participate on the national level in some roles. Would you like to comment?
Yes, thank you very much, Dr. Samina and Dr. Arman, for giving this opportunity and setting this up. So I came to America in 1998. So 2008, I got my green card, and that was the time when Senator Barack Obama became the president. And that was my moment, because I thought of a minority person becoming the president of the most powerful and the richest country of the world. But then I think and then I got involved in fundraiser, regular politics that, most of us do. But then my moment came in 2016. 2016, one of my friends told me about a Senator, Bernie Sanders, and that he was challenging Hillary Clinton. So I thought probably, I didn't even know the senator who he was. But my friend told me that young people are behind him, and there's a lot of their issues that he's talking about. And I think that is when I really got involved into issue-based politics. And then I was fortunate in 2020 that Senator again had the run, and they were looking for somebody in Nevada, and I became his campaign co-chair. And I think since then, what I have learned is that politics should be about issues and less about like who you are or the identity. You have to listen to what the issues are. And then I got an opportunity to get into Nevada Democratic Party, and we had a progressive slate because, so we defeated the moderate Democrats, or whatever we want to call them. I call them the establishment. So my politics has more been of organizing, and that's what probably I basically think, that we need to organize our community so that more of Sauds and more of Suleiman Lalanis are elected, and more support they have for the issues. So that's my journey. And then I was just fortunate to become a member of DNC. That's a Democratic National Committee, because I was the vice chair for the Nevada Democratic Party. So that's my little journey.
Thank you.
Great. Thank you. So next question is for Dr. Lalani. So Texas House District 76 is one of the most diverse districts in the country. How has your identity as a Pakistani-American physician shaped your legislative priorities, and how has your community responded to seeing one of their own in the State House?
Well, my identity has shaped me a whole lot, that how I serve. I know what it means to navigate the system, which not necessarily has been created with you in the mind. And I also know what it means to be a community which feels unseen until they have somebody of their own who knows their story to represent them. So I bring that same lived experience when I'm on the floor. I'm very passionate about healthcare access, affordability, education, technology, security, and fair representation. And the community is very gracious, very receptive, very proud. I mean, every time somebody sees me, it's like, oh, I can see the proud and pride in their eyes. But more than that is when I am walking on the hall and I'm moving the legislation, it gives them hope that we belong to this power hall. We are not need to be outsiders. We don't need to sit outside. We belong on that table where decisions are being made. So it's a good moment for the community, good moment for us. And I want to take this opportunity to let people know more that, you wanted a medal, you got the medal on your chest. Now, what do you want to do with that? So as Zafar was saying, we need to organize, we need to engage, we need to activate, we need to be part of it. And that's what I think when we all become the part of the puzzle, we'll have a big picture and we all will win.
Great, thank you. Now, on a similar pattern, Dr. Anwar, Connecticut has a strong tradition of physician involvement in public health policy. What was the biggest culture shock moving from practicing medicine to the legislative floor?
Quite a few things. So in the medical world, we actually look at what is the standard of care, how do you actually approach and solve a problem, and this is the data, this works and this does not work. In the world, in that manner, we recognize that science is how we look at things. In the policy, science is not in the front seat. It's how people feel, how the perceptions are. And now in the current world with the various powers that are there, including social media, people have perceptions that are created and it's their emotions that are driving things rather than the science behind it. So making that connection is very tricky, and it's this divergence is quite significant. And perhaps we have never seen it so diverge in the history of our country, where the federal government at the current time is at a complete different direction. You have RFK Bobby Jr., who actually does not believe in the science. He believes in another form of a science, if you will. He believes that is science what he's working on. And then on the other hand, we have all the scientific world, all the organizations of the physicians and scientists and people who have invested their entire life. They're saying, no, you're wrong. So this is part of the difficulty that we are seeing, and it's across the board. We're seeing segments of the population who are not following what would have been traditionally the way to approach things. Now that because the information is accessible, anybody can go to Google and AI and Chat, GPT, and also PubMed, and then they can start to look at the literature, but they do not necessarily understand what the physician training goes through. So that's one big issue that is going to remain a very real issue till we have a better handle on it. The other part that has been tricky has been that in the medical world, we are preventive. We're thinking about what can I do today to take care of this patient so he or she will have a long, healthy, prosperous, effective, healthy life. So that's what we focus on. Healthcare policy, on the other hand, is reactive policy. So anecdotes lead to policy making, and multiple anecdotes lead to an absolute policy formation, but does not have as much to do with science part. So those are parts that are there. The good thing is that when you're in that room, you're having these conversations, you're able to make sure that you are able to, of course, share the background and the rationale and why it's necessary. And everybody comes to the table hoping to learn something new and to be able to make a difference. So we can still educate individuals, be part of the process. And another thing is that you never give up in policy making. If you believe in the policy, you look at it as a process. If your bill doesn't pass in the first year, you bring it again and you have the conversation, increase the number of people who are going to be supportive. So that's part of this. It's almost like a patient who doesn't want to take your medicine. So you have another meeting with them and say, okay, this is why this medicine is necessary. And you give them the entire story and then tell them the pros and cons and perhaps give them enough reasons to do it. So that's how you approach many of this. Thank you for this question.
Great, thank you. Now we learned about your journey to get here. Now let's get into a little bit more specifics about healthcare advocacy. So my next question is to all the panelists. APPNA's mission centers on healthcare excellence, social justice, and humanitarian causes. Can each of you name one piece of legislation or policy initiative passed or pending that you're most proud of as a direct expression of those values? You can go with the same order, Dr. Lalani.
Well, there are many, but I think I'm going to focus on three that are related to healthcare. So in my first session, for example, mental health is very important to me, and I'm very passionate. So I had passed a bill that all Texas colleges and universities now are mandated that during the orientation of new students, they have to add the mental health office in their campus tour. So now, as a parent of three boys, I know when the kids are going to college, that stress, anxiety, depression, that plays the role. These kids, half of them do not know where to get help. And few that know where to get help, they don't want to go because they don't want to be pointed out by their peers. So my bill mandates that everybody would go through it. Hopefully, when the crisis happens, somebody would know when to get help, and that human connection is built up, and they'll be more receptive to get help. Other bill is last session we passed the Doctors Act that is helping reducing some of the second residency requirement and giving them the license to practice under supervision, especially in the underserved areas. So I think that's a real legislation that we pass, that we have the doctors who are able to go where the greatest needs are. So matching the need with the talent. Last session I also did $200 million for community grant for chronic disease management. So Medicaid is kind of a curse word on the floor. It has become a very politically motivated. So what I'm trying to do is taking it around. So I'm trying to do like we did, increasing the postpartum care on for 24 months for the pregnant ladies, and we did children thing. Now I was taking the care of chronic disease management, so we can give to the charity and nonprofit clinics. So those are the few things we are able to make and mobilize and kind of bring people on the table.
So I'll answer the same question, and so it's tricky. It's almost like asking which one of your children you like the most. And there's so much emotion in many of the bills. So I will not say one, but I'll give you a list of things that I'm very proud of, and allow me to be able to do that. So Tobacco 21, we were one of the first few states. When I was the mayor, my town was one of the first towns that actually said nobody less than the age of 21 can buy any tobacco products, whether they're vapes or cigarettes or combustibles. As soon as I was in the Senate, we were able to pass that bill. Connecticut became one of the first few states that did that, and now it's a federal law. So as a pulmonologist, this was very important for me to reduce the access to cigarettes. Private equity has been hurting healthcare, especially in the hospital setting. So I've worked on this bill. It is not yet a law, so I'm working on this time. Many hospitals have closed across the country in the most vulnerable parts of the country. So I'm fighting that one to create one of the bills. And at the national level, I've been asked to speak at various levels. The federal bill that is being proposed, they have actually the federal government, Senator, who are working on this, they actually asked me for my advice on what the bill would be, the federal government as well. Then the vaccines, we actually, in the state of Connecticut, we have the highest vaccination rate in the country, one of the highest. And then we were able to make a bill which was focusing on making sure that only the medical exemptions would be allowed. So that has really helped us out. The healthcare and the value of the health of a child, we are number 3 in the entire country right now. And for the women's health, we are number 7 in the entire country, and we are about the top 4 healthiest state in Connecticut. In the last few years, we've actually started to improve further at this time. So we have the lowest number of smokers and lowest number of vape users in the country, which gives me another reason to be proud of as well. And this is a lot of effort that we have put into making policies around this. I was able to write a bill, which is the only of its kind, which is actually a hate crime task force, almost creating a state police to look at the hate crimes and almost act like an FBI, if you will. And this was during the first Trump presidency, where they took all the domestic terrorism funding away from the FBI's priority. So we actually created our own FBI-like entity and put funding into that as well. Then post-pandemic, mental health became a huge issue especially for children. I was actually fortunate to be chair of the Children's Committee and the Public Health Committee at the same time with two big committees. And we were able to write bills. We were able to put in $300 million. At that time, we had ARPA funds, which is the funds that we had as a federal level for the protection and taking care of the post-pandemic era. It has been very effective. We've actually, I know many of the APPNA members, it's a diverse community within APPNA as well, but many of them are of the Muslim faith. So we are able to create a Muslim Heritage Month in January in Connecticut. We've actually now made it a law that Islamic and Arab studies curriculum would be part of an option for our children in the school systems to be able to have that. We've increased voting access. We've got debt-free community college in our state, reproductive rights in Connecticut. We are getting patients from all across the country. We make sure that any woman, whatever they choose, they will be protected in our state and they will not be hunted the way they are in other parts of the country. I've worked on school indoor air. We had funding, so we actually made sure that our old schools, which are 50, 60 years old, we've been able to put funding and access for new HVAC systems so that the children will be breathing good air, and data privacy on the website and so on. So I could go on and on. This is the area that I wake up with and go to sleep with on the policies to help make a bigger difference, and just feel very honored to be able to make a difference in my living capacity.
Great, thank you.
And I think for me, the two policies, one was in 2008 when President Obama in 2010 came up with the Affordable Care Act. I think the biggest problem in America is that access is an issue. Everybody doesn't have access to healthcare. And I think Affordable Care Act made it possible by expanding Medicaid and making sure that people have more access to quality healthcare, not the insurances which will deny most of the things. So I think that was one policy initiative. And next one was when they made the medicines, the insulin co-pays at $35. I think that's another issue that we as a society face, that corporate America, this capitalist system, has made sure that people don't see healthcare as a service. They see healthcare as a money-making thing. And I think these are the two legislation which are very dear to my heart, because we all know that, as Saud had mentioned earlier, the private equity is an issue. The capitalist system is an issue. So the way to go, what Senator Bernie Sanders and the progressive movement had made clear, that there is only one solution, and that's a single payer. And these medication companies, these pharmaceutical, can't charge these prices that they're doing. So I think these are the two policies that, has really been very close to my heart. Thank you.
Great. Thank you, Dr. Iqbal. And actually, it's a good segue to next question to you specifically. As a party official rather than an elected legislator, your advocacy works through different levers of power. How do you influence health policy from inside a political party structure, and what can APPNA physicians learn from that pathway?
Thank you, Arman. It's a very important question. I think politics is for change, and the change only comes through organizing. Power, and if you look at the history, 1965, Lyndon Johnson was not a very progressive president, but he, because of the public pressure, had to put in those civil rights legislation through which all of us are here. Before that was not possible. So I think the most important thing is organizing. If you build enough pressure through organizing, then whoever is in power is forced to make those changes. And to organize, you need a party, or you need a group within the party, like how the progressive movement, or how we have seen Zoran Mamdani's movement within the Democratic Party. I think that is what is needed, that we come together, whichever party we choose. But to tell you frankly, right now, there's just one party. Unfortunately, Republican Party has, it is no more the party of McCain's and Jeff Flake, when it was a decent place where you could discuss issues. So I think Democratic Party still is a place where people can have dissent, can organize. So my suggestion would be that this is where we need to get involved and become a part of it and, make more noise. Thank you.
I think the next question is more towards all of you. It's relevant to all of you. So as physicians, you bring a credibility to policy discussions that's hard to replicate. So can you share a specific moment, and then, we'll go one by one, where your medical background gave you a decisive advantage in a legislative debate? Because of your medical background, your credibility came into play. So we'll start with Dr. Lalani.
Well, there are many instances of that, but I will again refer back to my mental health bill that I had passed. I generally tell my colleagues, we are not in just a business of fee-for-service transaction. We are in a business of trust. People come to us because they have faith in us, right? So my mental health bill that I was trying, it passed the House, it got stalled in the Senate. And I was talking to all the senators and, they saw the passion, they saw the credibility. And it was the last day, there's a system that happens that by a certain time, you have to pass the bill in both the House, and if it doesn't, then it dies. It was the last day, about the last hour before midnight, I get a call from a senator who was actually from the other party. And he calls and says, you know what, Dr. Lalani, I know you're very passionate about your mental health, and I'm sorry that your bill is stuck here, but there's another mental health bill is coming from Senate to the House, and you can put your bill as an amendment on it. So I was a new legislator, and I would have not done that, so I give that credit to that senator who made the call. And I think that was just because of the credibility that we held, the honesty that we have. And then he gave me that call, that tip up, and then we quickly worked on. I spoke to the chairman who was dealing that bill that was coming over, and God willing, we actually passed that bill, right, a few minutes before midnight. So that always, I give credit to that senator. So that's the credibility we bring on the floor.
I can answer the question too. So, Samina, I'll give you two instances, and they're small, but they're very big in some ways. So there was a bill, and believe it or not, there was a bill in Connecticut which basically said that a psychologist can go online for 40 hours and they can become a psychiatrist, which means that they can write prescriptions for medications for patients with psychiatric issues. A psychiatrist goes through 20,000 hours of training, and then they're going to put somebody on a 40 hours of online training, and they will be writing prescriptions, which was a disaster for the well-being of our patients and so on. So, and then they had full support because there's a shortage of psychiatrists, and there's a shortage of care that can be provided. So the entire team, everybody was on board, but we had to intervene and actually walk them through the fact that medications are not safe. You can actually make a poor diagnosis, wrong medicine can be deadly for patients. And it takes months before you can get rid of the impact of those medications and before the medicines would work. So we had to put in a lot of effort and organize, but literally had to fight to get people to not pass this very poorly thought out law. Another one was, believe it or not, in 2019, they were actually trying to bring asbestos back into manufacturing. I'm a pulmonologist. I'm specially trained in occupational lung diseases. As an occupational lung disease expert witness, I've seen far more mesothelioma and lung cancer patients from that than probably anyone in Connecticut has. So they were bringing that over. So actually, and they had the votes for it too, believe it or not. So I had to put it on the floor and then made sure that that bill would not pass. And I actually told the people who were trying to put that in that as long as I am serving, you will not be able to bring asbestos back into manufacturing. And it's fascinating that we are having these conversations in 2019, that the evidence was back in the 1960s that this is bad for us. But here we are. So just a couple of examples, but we wear this hat of being a physician every day, and that remains very much part of our conversations every single day as we look at things and bills.
Thank you.
Yes.
Dr. Zafar?
Yes. So I think I ran for office within the Democratic Party twice as the second vice chair, and then I was the vice chair. And within the party, there are around 350 people that vote. They are all those people who are active, and it happens throughout the 50 states. So as a physician, it gave me a tremendous edge. And that is the reason I want to encourage each one of the physicians that when you go out for an election, being a doctor, people trust you. And then you have a responsibility that you tell them what is right. And I think if we pick up the issues like single payer and how the medication coverage, they trust us what we are saying. So I think in both the elections, I was able to, though very few people really knew me, but they would trust me when they would hear. So I think that each one of us being a physician, it gives us a tremendous edge. Thank you.
Okay, so this brings us to our third segment, which is going to discuss challenges and the current landscape, things more relevant with the issues today. So within the APPNA bylaws, my committee, specifically the Advocacy Committee, is given a charge specifically to address and sort of face issues around immigration for new physicians. And so as legislators, what do you see as the single most urgent legislative threat to Pakistani American physicians and their patients right now? So this is addressed to each of you one by one. So we'll start with Dr. Lalani.
Well, I think it's the growing instability that is going in the intersection of immigration, civil liberties, and healthcare access that kind of goes by. And also the broader climate of hate, fear, and polarization that is going on. So when the community feels threatened, when they feel that they are profited or they feel that politically scapegoated, the trust in the institution, it starts to fade away. So I think that's what we need to focus on is the triad that is going on, not just the immigration, but it's also the civil liberties and the healthcare crisis that are going on. So that's what I'm working on, to build on all three together.
I'll just add, I agree with what Dr. Lalani has said, but I'll just add another couple of aspects, and more from the physician lens. I think our profession is under existential threat, and making a very big statement. Why? Because people who have had a fraction of the training want to act like physicians, and that's a very real aspect. So the scope creep is very real. It's happening across the board. So that's one part. Majority of the physicians are employed now. In the national levels, it's about 70%. In Connecticut, it may be up to 80%. If you're an employed physician, you are also likely not to have the rights to be able to organize. And when you cannot organize, you cannot function. Well, we are able to pass a law that allowed the physician in the state of Connecticut to organize or unionize if they choose to, right, by a large employer, non-state employed system. So that's, but at the same time, you are worker without rights, and with the artificial intelligence that is going to be used, and the corporations who are interested to try and make more of their money, so the CEOs can make money, they will replace you with the physician assistants, APRNs, or other individuals with no training, and you will become less relevant. And the insurance industry, with the heavy-handedness, will make sure that financially you're not going to be well enough to be able to be relevant in any case. So this is a perfect storm of becoming irrelevant or probably an existential threat to our profession. And that is what we will have to collectively fight for. And then APPNA will need to take a lead in that effort as well.
Yeah, Dr. Mina, I'll just add to what Dr. Lalani and Saud has mentioned, especially the threat from the private equities as they are going around buying. And I'll just add to what Saud was saying, that then they want those providers not more concerned with the quality, but more with how much they can make money from them. And the nurse practitioners and others. And I think this is the biggest threat to us as physicians, and that is where we should get involved, promoting more independent practitioners, promoting that less control of the money in the healthcare system. So I think that this is the time that we should get involved. What Dr. Lalani has mentioned, that is also very important for our younger physicians who will face this environment of discrimination, hate, and so the more we are involved, the more we can safeguard our rights. Thank you.
Okay, so something that all of us know and are very sensitive to, especially APPNA, So the immigration policy currently for international medical graduates, or IMGs, has been increasingly volatile. So what are each of you, and this is more addressed to Dr. Anwar and Dr. Lalani, what are you each doing legislatively or politically to protect our pipeline of IMGs? And as you know, IMGs fill the underserved areas mostly in the US. So what are each of you have done or are doing to address this?
Well, some of the answer was in your own question too. So that's what I try to do. One is to keep the issue visible. That means that, we're not wanting to discuss that IMGs are some side discussion, but these are the front and center of the healthcare. Number two, I bring up the need that, we have the expertise and we have the greatest need, how we can match the talent where they want to go and serve the underserved areas where the need is. So stay visible, stay relevant. And then I try to bring in the bigger issue that healthcare access and affordability. And then we can have that improved access only when we have more physicians. And we have this challenge in our state. We have the challenge in many other states too. And one of the challenge we had was we were actually creating, believe it or not, more medical students than we have the residency slot. And I was telling my colleagues, we looks like we are penny wise and pound foolish. All that money for somebody to become a doctor and then hand that doctor on a platter to another state who would go and do the residency somewhere else. And then half of them will never come back. They will settle there or whatnot, right? So I had passed the legislation which gives more funding to GME and things like that. So that is my constant goal, is to keep the issue visible, keep the issue relevant.
Thank you.
I'll just add a couple of thoughts as well. So this is an important question and very relevant. First and foremost, I'm a state legislator, so I do not write a federal policy. So that is a federal law that is being played out and it's working. However, I do have access to the federal legislators. So when there is an issue that comes up on a case-by-case basis, it's easy for me to, compared to anybody else in the community who's not elected, for me to be able to reach a legislator to be able to look at that specific case. And we've been fortunate to address that, at least if it's in Connecticut right now. So that's one area we can help out. The other challenges, and I think Suleiman Lalani, he's been very successful in the bill that he had about the physicians. I tried to actually replicate Dr. Lalani, your bill. It didn't go anywhere in my state because they said, well, we don't have any challenges and we don't have any underserved areas, so we don't want to have the support of that kind. So I tried it and I was beaten pretty badly on that one. So I'm going to try to do more groundwork and try to do something around that part. It's state by state as well, so it's not an easy process. I think the bigger conversation is that if 100 medical students trained in the United States graduate, only 93 of them will be able to get into a residency program. So the US graduates, 7% of them will not get into the residency, and that's the US ones. So what is the probability for somebody from out of state coming in, out of the country coming in to do that? So that's where it's getting tougher. And the ones who don't match, they're in the matching numbers as well. So when you have residency slot, you'd be surprised for 2 or 3 or 4 slots, you'd have 200, 300, 400 people apply. And it's not sustainable and healthy. And then the policies that we have in the country are that I actually took care and I highlighted or wrote an op-ed. I have a physician trained from Hartford and studied here who's living out of a car because he never got a residency, because he was delayed from the residency because he didn't have the money to sit for the boards. And because he could not sit on the boards, he had 3 years of lag. Nobody got him into, he's an African American, nobody got him into a residency program, and he's a physician, we need them, but we cannot get him because he was not resident. And on the other hand, APRN, I actually had an APRN, I should tell this story. APRN sent me a patient, I called her back to say, hey, I want to talk to you about a patient. And they said, oh, she doesn't work here anymore. So what does she do? She's a dermatologist now. So you wake up one day, you go and become a dermatology person, and the next day you're an oncologist, and the next day you're an endocrinologist. And the doctor who's gone through hell and back does not get a residency, he has to live in a car. We are so royally messed up in our society for our fellow physicians from US alone, let alone the international medical graduates. And then that's where we'll have to combine the resources readdress the issues. And if you have a child who wants to be a doctor, you would tell them, beta, koi acha kaam kar lo, koi cheez bech do, ye kaam na karna. Because it's not sustainable anymore. Because how are you even going to pay the debt for healthcare and the education? So it's a major challenge that we have, and yes, we need international medical graduates, but we need to reshape the structure, and we are coming towards a very big, challenging situation for healthcare and the healthcare workforce that's going to be pretty ugly in the next many years with AI revolution in the picture too.
So I think that comment, "Ke beta koi aur kaam kar lo," everyone, I hope you had your volume low so the kids didn't hear that in the house. Okay, so now this is a question for all of the panelists here. So keeping in mind your very hectic schedules, such as webinar participation on a Saturday afternoon, your legislative jobs, your physician roles. So I'm going to ask a question about physician burnout. How do you balance the enormous demands of your elected office responsibilities as well as the responsibilities of maintaining and functioning within your clinical practice? And so this is to each one of you.
Well, it's a difficult question, but it's also a fun question, I believe. So I kind of focus and derive my energy from three sources. One, I say, keep the life balance. You work hard and you play harder. Make sure you are intentional about finding time to have some fun, intentional about having time with your family, and some me time so you can recover yourself. Number two, I would say that I derive my energy from my faith, from my family, and from my patients. Literally, when I go to a facility and I see patients, I come out more energized than I've gone in. And at times I've gone to my facilities to see patients like 10 at night or whatnot. And then finally, I would say service. Because, we all rise by elevating others. And then, when we are giving our service, and to me, this position of legislation is also, I take it as service. So when you do that, you derive the pleasure and contentment, which I cannot describe in words. And the prayers of people that you get, and then positivity that you follow. There's always 2 people who are pulling you down, but there are always 10 people who are elevating you. And you may never know who those 10 people are, but there are. And you will find those hints in your life that, oh, this happened. Okay, something is happening. And finally, to my colleagues is find your passion, find your calling. If you find your passion, then you never get tired. You're going to do things because you get energy, interest out of it. So that's how I try to manage mine.
I'll just add, I think it's a labor of love. We do this because we choose to do this. And it's the same way. If you look at all the physicians that are within APPNA or beyond, you'd be surprised how many hours we put in through residency, fellowship, and then the work that we do. And it's out of love. If you did it to make money, you're in the wrong profession. And if you did it only because you had no choice, then you're in the wrong job. You do it because you love it. And that's what it is. I actually love all of these things so much that it became tricky because I was starting covering the ICU. At 4 in the morning, I would be in the ICU, and then I would be working till 11 p.m. And then the next day, there was no time and no ground time. It became too tricky. So last year, after doing the ICU, I stopped covering the intensive care unit. Now I do only outpatient work, which is a new life. I never realized for 30 years there was a life outside of the intensive care unit. And I'm out of that prison, and I loved every part of it, every bit of it. But now I actually am, alhamdulillah, doing more work in the legislative capacity and learning a little bit more about how I can make a bigger difference. But if you don't love what you're doing, don't do it. Life is too short.
So, Samina, it's a very important question. I passionately believe that we work a lot, and especially to younger physicians, I would tell them, please don't burn yourself out. Don't work 7 days. Here, I personally think that those who are in private practice should think about having their own practice, because that gives you an opportunity so that you can use your time the way you want it. And as they get into their 40s and 50s, I think then they should invest that time saved into what they're passionate about. This is what life is all about. And I would highly recommend people, A, that they shouldn't work 7 days. I think ideally they shouldn't work more than 4 days. And then think those 3 days what they want to do. Maybe politics is their calling. Maybe some other fun that they want to do and get engaged with. So this will be my recommendation, that please don't work so much.
Thank you. So this is sort of a segue into the next section. Dr. Rahman has a few questions.
Sure. So, it's next segment is a call to action for the members. Many of the members want to advocate, but don't know where to start. So what is the single most practical first step a busy physician can take to start engaging in local or state government or politics?
I think the first thing they should do is to build relationship, and don't wait for the crisis to happen. And when I mean build relationship, is not just go to an event, make a donation or take a picture, but actually make a genuine relationship with your elected officers, and then find again where your interest lies, what your passion is. You may like city politics, and then go towards who is your city or council members, what are things are happening. If your county or federal is your issue, or state, so
I think his line dropped out, so I'll continue what he was saying, but I'll just say I completely agree with Dr. Lalani. I think Dr. Raza, what you were saying was, what do we do right away? What can people do right away? I think every engaged citizen needs to know who's their mayor, who's their council member, who is their state representative, who's their state senator, before anything else. You'll see many of these things, and then my fellow colleagues, myself included in the past, यार कांग्रेसमैन के साथ तस्वीर खिंचाई थी, यार कांग्रेसमैन के साथ मेरी बात हो रही है, वो कांग्रेसमैन से मेरी दोस्ती है. कांग्रेसमैन के साथ आपकी दोस्ती इसलिए है कि आप उसको पैसे दे रहे हो, और perhaps आपकी ज़्यादा दोस्ती इस वजह से भी हो सकती है कि you have invested a lot of your time and relationship and help get them elected. That's the relevance of all of that. But most of the things that are going to impact you, your children, your family are going to be local people, your mayor, your community members who are elected, but also the state. And your licensure is through the state. Your work is through the state. The policies are going to be through the state. What Medicaid pays you, does not pay you, is through the state. So know each and every person. It's the responsibility of the elected officials to be in that position to serve you better. But you need to have their cell phones. You need to get to the level that you need to be able to text them and say, okay, I don't like this bill. I want you to vote no on this bill. I'm watching this. And have that relationship, have that understanding, invest in that relationship, do it as if your children's lives depend on it. I'm saying a very big statement because unfortunately, it may khuda na khasta. So I picked up where you left, Suleiman. So, and I attributed a lot of good things under your name. So you can talk about it. Can you hear me?
yes, I don't know what happened, but it reminded me of the load shedding back home.
So I'll just extend what Suleiman and Saud was saying, that the most important thing, and you'll be surprised at how easy it is to build relationship. Your local senators, mayors, they're looking that people do contact them and have relationship because they're going to come for the next elections. But in addition to that, I think we should get involved in our local, like DSA. Every place will have a democratic socialist, like what Zoran Mamdani's case is a really good case for us to see. How as a young person, he became a part of the DSA, because through that you learn about issues. It is difficult to know what are the policies there. We should know whether you are focused on healthcare, education, you're worried about how the budget is spent. You need to know the issues and what are the solutions. So I would say that get involved in your local DSA or any other organizing groups. They're on climate, they're on many issue-based things, but get involved in them.
Great, thank you. This will be
I don't know if this was added or not, but I want to add one more line for physicians is you can also become a resource person for your people. Not just really, but become a resource because you are a smart person, and we all require, we are not expert in things, right? So if I need some help in, let's say, some cancer, and I can pick up the phone and say, I can call that oncologist. Can you review this and give me 10 pointers or some other medical issue that are happening, vaccines are happening or whatnot. So we are very good. We can do research and we can become a resource person. So that's another option is you don't have to just show up and pay your checks and do things, but you could be a good resource and do that 2 hours of just be a resource for somebody.
Great, thank you. This will be the last question from us. So APPNA has over 4,000, maybe sometimes close to over 5,000 members across North America. As an organized block of highly educated, civically engaged professionals, what is our untapped potential and what would it take to realize it?
Suleiman, you want to start again or do you want me to jump in?
I think it's the last one. Why don't we give you the honor?
I was just following what you said. मुझे तो सोचना भी नहीं पड़ा. I will just share. First and foremost, I think, look, in order to get things done, you need power on the inside and you need power on the outside. If one of these parts is missing, you cannot get anything done. So you actually have to figure out that you look at the long-term strategy that you have to build power on the outside. That's critical. And then from that power on the outside, you start to have individuals selected who will serve in various offices because it is a calling and it's a capacity. But in the interim, you have to have capacity building. Many of the people who are in the first generation, they actually were born and raised in a different country where the systems of communications are different. The ways of how you address the issues is a little different. Learn what works in this society. The passion is important. And keep the passion alive, but see the communication skills, whether you write a powerful letter or have a communication and understanding, all of those things. And we learn that as physicians all the time. So make sure you have that capacity building. But you're also influential within your own community of similar heritage in the places. That's where your role becomes even more relevant because you are automatically a leader, highly educated individual within that network of communities that you have. Make sure that you work on capacity building of that community and the next generation too. That's going to be critical, and then you're able to have an opportunity for individuals to grow and learn what it takes to be elected for positions, how you can be more effective in policy making, and keep in mind that losing is not an option, and so you have to figure out how do you figure out to be successful and then keep strategizing and working on those aspects. So thank you.
Okay. Thank you. So we have one specific question that came in for Dr. Lalani. It's about, so I'll read it out verbatim as they submitted it. So they're saying there was a request document entered into the Texas legislation system to allow foreign trained dentists that are living legally in Texas to be able to get credentialed for at least performing as dental hygienists. So directed specifically to you, Dr. Lalani, can something be done if they're able to mobilize enough licensed dentists to rally for passing something like this?
I would have to research more before I want to open my mouth on this particular question. But certainly we can do. I think, again, the same rules apply, the engagement, do the advocacy, and whoever that person is, please share my contact, call with our office, let's review what the issues are. And like we have done the mid-level provider, the issues that were coming in, like we talked, Dr. Saud Anwar talked about how the physicians and how the mid-levels are coming in, what issues are happening. Similar things are happening with other medical professions too. So I think we can certainly take care of it when I learn more about it.
Okay, so I'll open this up and let's just see for those of the people who attended and are online. If there are any questions online, they can raise their hand and we can either or send a question in the chat. We'll read it out to our panel. So while that's happening, we'll see if any questions come up. I'd like each of you to make a closing remark before I and Dr. Arman do our closing remarks. So any concluding statement from you? So we'll go again in the same order. Dr. Lalani, before we end the webinar.
Well, thank you again for doing this. This is remarkable that we are doing it. If you allow me, I want to add two more points on our last question that what APPNA can do. And I'm going to frame it into two. One is the APPNA members. APPNA members, please participate more in civic engagement forum, seminars, roundtables, and whatnot. And also, for APPNA itself, I would say, do more advocacy day, be more organized. Number two, partner with mainstream organization. I'm yet to see APPNA will sit with a county medical society or a national medical society or something else and come up with that we are partnering this with this program or we are doing this research. I mean, we have a big resources. I mean, we have people who do research in different things. Our population is unique. Why our new papers are not coming into the medical journal or whatnot? So partner with medical societies and do things. And number three, we can do medical PAC, where we can come together, we can endorse right candidates, we can make donation, and more importantly, we can educate that we can become a voting bloc where there we will be significant. Because right now, we are all participating, but we are all in our silos. So I think we can bring more unity.
Excellent. So just to your point, I'd like to say that we at APPNA Advocacy this year have made a very concerted effort to do exactly some of the points that you said. We are joining and collaborating with the AMA on aspects of easing the visa restrictions that have just been implied. As well, we're joining other physician organizations, the parallel or counterparts of APPNA, such as API, the BAMA, the Bangladeshi Medical Association. So we're seeing the importance and the need to collaborate with others with the same agenda and with the same challenges in policy. So thank you. That's a very important point you make. And we are working towards that to achieve that in that fashion. Dr. Anwar?
Sure. Thank you for the good work that you're doing. Thank you for what APPNA is doing. I want us to see if there's an opportunity for APPNA, while it's performing multiple other roles, to actually have an institutional role, where it's a capacity building institute, which actually allows individuals to be able to achieve their full potential outside of medicine if they choose to, and have ways of mentorship and so on. If individuals who are listening, not the collective of APPNA, but if individuals who are listening, if you are in a room that everybody looks like you, you're in the wrong room. If you're in a room where everybody thinks like you, you're in the wrong room. Try to be in the right rooms where you can actually have frank conversations and you actually can be a bigger solution for issues. Medicine is knowledge. Knowledge comes with power and responsibility. And that responsibility is to be a voice of reason and solutions in a time which is unprecedented. Recognize the value of the current time. We are living in unprecedented times that many of us would say, and many patients of mine that I interact with being over 90 years old, they say they have never imagined we would be living in a time like this. And here we are, and so we have an immense responsibility, and therefore use the gifts that you have acquired, but the gifts that you've been born with, to be part of the solution. And I think you have two questions in there.
Yeah. I'll just add that thank you very much for doing it. I think this is exactly what APPNA should be doing more webinars, especially using the summer meeting. I remember last time Saud was also there, Suleiman was also there, and it was people were interested to come, but it was not very well. I think APPNA should give some prime time to the advocacy committee so that they can bring those people together. What I think that PACs are one thing where you give money, you pool your money, which is also very important. But I think where APPNA should focus is helping. We have 17,000 physicians throughout. It's so much resource. I think we should focus on C4s like APPNA can, because we should learn from the Jewish community, see how they have organized. I think we should have more 501c4s which can organize and affect the political things more openly than C3s. So I think that is what we should guide our members, that how they can become a voting bloc, they can pressurize on issues, and they can put more pressure on their legislatures. And so I think that'll be my suggestion.
Thank you. So we have two questions. I don't want to ignore those, so we will give them the opportunity. So I will put them on allow to talk, but please introduce yourself first. Dr. Zishan.
Hello, Assalamu alaikum. This is Zishan, child psychiatrist from New Jersey. Thank you again for such a wonderful talk. I think especially the mental health, thank you for highlighting it. So what are some talking points? Because I'm involved in New Jersey, and we just have, I think, a bill where they allowed nurse practitioner to practice independently recently, who fought but didn't win. So any talking points when we are talking to our legislator, how we can help them understand the quality of education and how to help them convince so that they can take the right decision. Thank you.
I will share with you. I think we lost that battle in Connecticut in 2014. So we've been behind, but I would just explain to people that the number of hours an individual has to go through a fellowship, residency and fellowship training is immense amount of hours. And for the APRNs in their pathway, they've unfortunately, for the detriment of their ability to clinically do the work, they actually follow one or so clinician for certain amount of hours, which is about 3 years or so, and directly without direct supervisions, without direct training effort, which is not the best way. And then I wish there was a way for them to get formalized, appropriate residency program training that would really give them the capacity to be able to do the work that a physician, close to the work that a physician would do. And that's where there may be an opportunity for them to function. That's more of an intellectual answer, not necessarily a political answer.
Thank you.
I will add to that, a lot of people are not expert and they may not understand the intricacies of the job involved. And I have noted that, moral ethics, best practices, there are good feel words, but it doesn't move people. So I've started now talking economics. And I would bring data like, look, if the mid-level is provided, how many hospitalization has happened? How many polypharmacies is happening? What complications are doing versus a physician who has knowledge and years of practice and training is doing. So you can certainly bring up those kind of data, and that certainly moves eyes and fingers in directions.
Okay, thank you. So we have someone else. One last final question we'll take from the attendees. If you'd introduce yourself. Go ahead, please.
Hanji, Assalamu alaikum. Muhammad Aslam here. I'm one of the board members. And thank you, first of all, Dr. Samina Qureshi, and thank you all the panelists, and especially my colleague Arman Raza for organizing this. This is the need of the day. I was actually driving, and I was listening while I was driving, trying to be paying attention to my traffic and all this. But thank you. I know these are the need of the day. I'm myself. I have was talking to one of the program director. There is a shortage of psychiatrists, as one of the panelists was saying, and even geriatric psychiatrists. And I think we have to come up with some ways to get involved the younger physician so that they can come to, in these kind of area of much need, especially psychiatry, I think. And we have kind of in our society some stigma regarding psychiatric disorders and mental health issues. So I think, thank you so much. And we need to do advocacy for mental health. As you know, in Pakistan recently, I think day before yesterday, one of the medical student, completed suicide in Sindh province. So thank you. These are all issues. These are very close. I think one of the panelists mentioned about the Beta Kuch Aur Kar Lo. That's the everyday discussion I'm having with my son, who has applied for medical school after MCAT, and he is interviewing. He and I have been talking about that. But thank you for all this. I just wanted to give my 2 cents and my 2 comments for that. Thank you so much.
Thank you, Dr. Aslam. There are a few
Dr.
questions.
Aslam is, if I may add, Dr. Aslam is very modest. Just for the panelists to know, he's also the General Secretary of APPNA. So I just wanted to
Thank you.
So there are a few question and answers in the chat box as well. Shahzad Iqbal asked a question, but I think it's already answered. He did ask about any action items for the APPNA as an organization, which I think has already been answered. I do have one question from the panelists, actually, if I'm allowed. There is this physician shortage everywhere, especially in rural areas, and then that's how it gets played out when the scope of medicine is discussed and so forth. How do you balance that? How do you reconcile the physician shortage issue and the nurse practitioner and PAs and even now non-residency trained physicians given some privileges? So how do you reconcile that?
Arman, do you want to take that? Or Zafar? Go ahead.
Well, I think we are in a time where a person who has the loudest mic gets the attention. I think we need to be more proactive in this issue. There is certainly an issue of underserved and physician shortage, but does not necessarily complements the mid-level which you are trying to say. So when they came to us last time, I had the data and I showed them, look, you all want the license to go, but what percentage of mid-level is practicing in underserved? They all are practicing in the mid-city urban areas. So they're finding the ways and you're trying to prove their point, but I don't think their heart is where their mind is. So we need to fight with accordingly. So let's build up the data. Let's do what it is happening. As I said, also number 2 was build the statistics. There are journals filled with mid-level providers giving care for the patients, right? And then what complications, what rehospitalizations, what happens. I take this to the insurance companies too. A lot of time, they are again penny-wise pound foolish. They would want to pay less because mid-level is providing. Then when I show them the data that this is what you want to do, you're actually losing money in long run because your patients are not healthy. This hospitalization could be prevented, which has not, right? So I think we need to bring data. We need to be more active. We need to be more engaging. That is one thing is that physicians are not doing it, Our physician thinks that their duty stops on their prescription pad. They think that the white coat belongs to the office only. But I want to remind our physician that your white coat carries weight beyond your clinic. And your voice not only just heals your patient individually, but can heal the society. So we need more engagement. And certainly our offices like Dr. Anwar or Zafar or who have experience, we can certainly mentor. We can certainly, one other point would be with APPNA. Maybe we can do 4 hours of Advocacy 101. And then people who wants to see how to testify, how to file a bill, how to do research, and we can just hold their hands and then connect them with their selective state offices or city places or federal, and then connect that connection. So I think we can do. I will volunteer my time, and I'm sure everybody else will do if we do 4 hours of 101.
I think I'll take you up on that offer. And that sort of ties in with one of our attendees' question. Dr. Shahzad Iqbal said, what are some of the action items we can come away with after this webinar? I think I have several in my mind, but I would like to sort of take this opportunity to thank all of you, conclude the webinar, and come away with some learning points and action items. So again, each one, Dr. Saud Anwar, thank you so much. Dr. Suleiman Lalani, Dr. Zafar Iqbal, absolutely appreciate your time on a Saturday afternoon. And of course, I'm very humbled that our BOD person, the activism lead within APPNA, my charming co-moderator, Dr. Arman Raza, gave us his time and expertise to join us today. So again, I want to thank the president of APPNA, Dr. Babar Rao, who gave me the opportunity to chair this advocacy committee. I certainly will be reaching out to each one of you as we plan and we formulate our Day on the Hill. That's going to be my jewel in the crown of APPNA Advocacy Committee this year. So I will definitely leverage each of your experiences to help me sort of make that a very successful one. As well, I'll take you up, Dr. Lalani, on perhaps, and Dr. Arman will be my partner in crime in putting up maybe a few more webinars that you suggested, just educating our physicians how to get more deeply involved in these legislative actions and participation at their local, state level, county level, whatever it may be. So I really appreciate your expertise, and thank you, and we'll certainly be reaching out for future collaboration. Thank you very much.
Thank you.
Thank you very much, Dr. Qureshi. Thank you, Dr. Raza, and everybody. Kudos to APPNA, who's actually thought about it and doing it. So I'm very happy and very pleased. I think our future is bright.
Thank you.
Stay well. Thank you.
Thank you. Bye-bye.